Hello everyone, welcome to Planet Ayurveda channel. I'm your Ayurveda expert and this video is on dysautonomia, as it is October and it is dysautonomia month. So starting with the definition, what is dysautonomia? Dysautonomia is dysfunction of autonomic nervous system functioning that generally involves the failure of sympathetic and parasympathetic components. This can be local or as a reflex to sympathetic dystrophy, or can be generalized, that is pure autonomic failure. Now coming on to the types of dysautonomia, then there are two types of dysautonomia: primary dysautonomia and secondary dysautonomia. Depending on the primary and secondary types, the causes for both type of autonomia varies. Like in case of primary dysautonomia, it is either inherited or is the result of degenerative neurological conditions. On the other hand, for secondary dysautonomia, the condition is basically acquired and is due to diabetes, HIV, long-term COVID infection, excessive intake of alcohol, Parkinson's and many others. All these factors basically result in the injury of autonomic nervous system and hence the situation occurs. Now let's discuss about the symptoms of dysautonomia or autonomic dysfunction. Then the symptoms that generally appear starts from anxiety, dizziness, incontinence of bowels, urine, difficulty in swallowing, syncope, exercise intolerance and many other symptoms like that. The patient might complain again and again that he or she is having generalized weakness, fatigue. Patient can also suffer from fibromyalgia, tachycardia, IBS, interstitial cystitis and many other conditions like that. Now the most important part of this video, that how Ayurveda understands dysautonomia. Ayurveda has a clear-cut concept that Vata dosh, which is having Chalguna, is basically responsible for any damage to the nervous system. Either the situation is the result of exclusive Vata dosh or of Avran. Avran is a very important concept in Ayurveda and it needs a very deep understanding of the basic things which are related to Ayurveda. Avrana is either understood as an obstruction or a covering, and Avrana only happens if there is presence of Vata dosh. As mentioned before, Vata dosh is having Chalguna. Due to its Chalguna, it travels inside the body and is responsible for any kind of voluntary or involuntary movement going on. There are certain factors that aggravate the Vata dosh, like eating too scanty or eating dry food articles or eating food articles which are generally astringent, bitter or pungent in taste, along with sleeping late at night, exercising too much. These are basically the causes that aggravate the Vata dosh. There is one more thing that all of us need to understand, that one should eat according to the digestive fire. If the digestive fire is good, then we should avoid skipping meals. Why? Because the Pradipta Agni or the enlightened digestive fire, if is not provided with something which it can digest, then it will start digesting the deeper dhatus inside the body. Once there is kshay of dhatus, then there will be aggravated Vata dosh. That is one scenario, but there is another scenario, that if the digestive fire is too low, and we are just eating and eating, then what will happen? Then it will result in the accumulation of amadosh or endotoxins in the body. These endotoxins will block the microchannels or srotas in the body, and then the obstruction to the pathway of Vata dosh will be there. As it is having Chalguna, then with the huge wave of Vata dosh, the endotoxins will be scattered inside the body to different places, and wherever they go, they cause stagnation and hence occurrence of diseases. Now, as we know the point of view of Ayurveda about this condition, then it's time to discuss certain herbs that can actually help. There are some Vatanulomak herbs like Brahmi, Ashwagandha, Jatamansi, Gotukola that helps in the anuloman of Vata dosh. Gugul, on the other hand, is having healing effect. Rasna, which is called as the Shresht Vata dosh Shamak, is also one of the herbs that can be used. Many preparations prepared using Rasna like Rasna Adi Gugul, Maharasna Adi Kwat will definitely help in this situation. Madhuyashti and Giloy can also be given so that the immunity of a person can be enhanced. Now, for each and everyone, if any of your friends or family members are telling you continuously that they are feeling weak, they are feeling dizzy, they feel like they will fall on the ground, or they feel like that they are having urine incontinence or bowel incontinence or things like that, then it's our duty that we should not ignore, because after viewing this video, we know that what that situation can lead into. At last, in case of any queries, you can consult our Planet Ayurveda experts through the numbers which are displayed below. Thank you.
अरे ये क्या बना रही हो?
आलू टिक्की चाट।
आलू टिक्की? और चिंटू कल पिज्जा खा रहा था पिज्जा।
तो क्या हुआ?
तुमने कल बाबूजी को समोसे भी दिए थे खाने को, और आज ये आलू की टिक्की। खूब तला हुआ खाओ, तला हुआ, फैटी लिवर हो जाएगा, बीमारियां हो जाएंगी, पता भी है कुछ?
तो क्या हुआ?
तो क्या हुआ?
प्लैनेट आयुर्वेदा का यकृत प्लेहांतक, बस आधा चम्मच सुबह शाम।
ये तो कड़वा है।
तो क्या हुआ? यही देगा लिवर की समस्या से जीवन भर का आराम।
ओके ओके ओके। आज तिवारी के यहाँ पार्टी है, बुला रहा है।
आज फिर पार्टी?
तो क्या हुआ? यकृत प्लेहांतक तुरंत मंगवाइए और फैटी लिवर की प्रॉब्लम से छुटकारा पाइए।